Hi, I'm Dr. Q with drqueston.com, and today we're going to be talking about how to take care of your male cat after he has neuter surgery. Well, first of all, I think it would be appropriate to talk about why we would want to neuter our cats. Well, for a couple of reasons. For one thing, a cat that's not neutered will often have a tendency to fight with other cats. If he's fighting with other cats that aren't in good health or aren't vaccinated, he could definitely get some diseases from that. And as well, you don't want them running away from home, wandering away overnight, where they could possibly get hit by a car or attacked by a wild animal. That's something to consider too. Whereas cats that are neutered will tend to stay home more often than not. The other thing to keep in mind is cats that are not neutered tend to lift their legs and spray. Well, I should say dogs lift their legs. Cats probably don't lift their legs quite as much, but they do spray to mark their territory, which is a behavior that you'll see not quite so often in a cat that's been neutered. So as you can see, there's lots of good reasons to go ahead and neuter your cat. And then if you have decided to do that and you're bringing your kitty home for the first night after they were neutered, the thing that you want to watch for is check his sort of rear end area and make sure, oh, I know he's kind of complaining a little bit. You just want to peek back there. That's all you really need to do, once or twice a day. You just want to look back there, make sure that you don't see any blood or swelling or anything that looks unusual. A lot of times these kitties, when they first come home from surgery, they're a little queasy after all the medications and the anesthesia, so you want to go easy on their food that night. Definitely make sure that they eat a little bit, but you might want to check with your veterinarian also to see what their particular protocol and their suggestions are. Otherwise, usually these guys are pretty quiet that night. Make sure they get their pain medications if they've been sent home with any. And otherwise, the big thing is to just check that bottom at least once a day. It does take about 5 to 10 days for something like that to heal, probably more like 5 to 7. But you probably want to check every day for about 10 days. And as long as the kitty's acting fine and behaving normally, not licking himself back there, and everything's looking all right, then everything is healing fine. Now, if you notice that your kitty is licking back there, that's a big problem. We definitely don't want that because cats have a lot of bacteria in their mouth, and they can get that bacteria into the incision site. So if that should be the case, unfortunately, dun dun dun, your kitty probably needs to wear one of these, which is called an Elizabethan collar. Buster collar, has a lot of different names, but basically it's a radar dish. Sometimes they're a little hard to put on by yourself. Sometimes your veterinarian will send you home with one. There we go. They slide on like that, and they get secured with a little bit of gauze or your kitty's collar, and then your kitty has that, which does allow him to eat and drink, but doesn't allow him to turn around and lick at his rear end so that he can't cause himself an infection back there. So those are some tips on how to take care of your cat after neuter surgery. So hopefully you've made this decision, and then you'll have some good results with your kitty afterwards when they get home and they get all healed up. And on that note, I'm Dr. Q, and the rest is up to you.